Hi guys, my name is Cheryl. I am the lab director here at Serviam Diagnostics and would like to demonstrate today on how to perform a successful venipuncture and kind of go over a couple of the steps that are really imperative to make sure we're reducing sample rejections, making sure we're getting a good successful poke, and overall making sure your residents get their results at the end of the day. So let's get started. First and foremost, just make sure you have all your tubes ready before even poking your patient, just to make sure that you're not in there and then scrambling around looking for tubes, or would have to redo this process, take out the needle, look for tubes, and come back. Make sure you have your alcohol pads, your needle, vacutainer hub, tourniquet, the tubes that you would need to perform the tests ordered, some gauze, and a Band-Aid, whether it's a self-adhesive or a regular Band-Aid. And with that, make sure all your tubes are labeled, whether you send them in with the requisition or not. Make sure all tubes have at least 2 patient identifiers, first and last name and date of birth. We will also send you a couple of labels if that's something you would like to go ahead and write on these and then slap them on the tubes. With that, let's get started. Okay, let's go ahead and tie our tourniquet on a little snug just above the site of puncture. I'm gonna feel for a vein. A vein should feel like it's got a little bounce. There's a good one right here. With that, I'm gonna release the tourniquet and then make sure I get everything else ready. I'm gonna use a 25 gauge butterfly needle that's right here. With this end of the needle that's covered in this rubber silicone, we're gonna attach the vacutainer hub. For today's purpose, I'm gonna draw all the colors of tubes that we do offer tests for. So we're gonna draw blue top first, red second, gold, and then our lavender in that particular order. Because I am gonna be drawing a blue top, and we are using butterfly needles, which have this long tubing, as you can see. We are gonna draw a waste tube for our blue top. Just always remember, if you are drawing and need a blue top, to always draw a waste tube. All right, we're gonna put the tourniquet back on, and we are ready to perform our venipuncture. We're gonna clean the site of collection. We're gonna go in counterclockwise or clockwise and work our way out. Set that aside. Make sure when you're grabbing your needle that the bevel is facing up. Using your less dominant hand, anchor down the vein by pulling tightly, and go in at a 35 to 40 degree angle and insert the needle. I'm gonna draw my first blue top waste tube. All I'm looking for is for this tube to be primed with blood. I don't need to get a full tube of the waste tube. I just need enough to prime the tubing of the butterfly. The second blue top is a tube I'm gonna be sending to the lab, so make sure it is filled to the frosted line. This is what a appropriately filled blue top should look like. It should fill to the top of the label. Any less, and that will skew your PT-INR results. So most labs, including ours, will reject it and ask for a recollect. Please make sure to draw the waste tube in order to avoid a rejection. Next tube will be our red top. Next will be our gold SST tube. And then last, our lavender. That is my last tube. I'm gonna release the tourniquet, grab my gauze. Without applying pressure to the needle site, I'm gonna slowly remove the needle. Put pressure now on the venipuncture site and disengage our needle. That goes to the side. I'm gonna tape up our patient right here. Make sure the bleeding has completely stopped before applying your Band-Aid. I always like to roll up some gauze in there and then apply Band-Aid just in case it still continues to bleed. While we are done with all of that, go ahead and take your tubes and gently invert 5 to 10 times. This is going to help make sure all your preservatives in your blood are being mixed well to avoid any of your blood from clotting. Once that is done, please do not leave your resident's side until you have labeled all your tubes with your resident's first and last name and date of birth. If you don't have labels, you can also write on the tubes. Grab all the tubes for this patient and put it in our biohazard bag before you leave the room, just to make sure we are not mixing up anybody else's requisitions and bloods with other residents. And on the requisition that you're going to put in the bag, make sure you write the collection date and time before placing it in the bag, just so we know that these samples were collected on the correct date. With that, we're going to fold in our requisition. We're going to put it in the outside sleeve, the biohazard bag. Once that is all complete, make sure to spin down your SST tubes. These are your gold top tubes, and these are the only ones that have this little gel at the bottom, so it can help separate your red blood cells from your serum. And this gold top is what we run a majority of your chemistry panels on. Make sure it's spun down at 4,000 RPMs for 15 minutes before sending it to the lab. Once you're done with that and the tube is properly spun, put it back in the bag of the respective resident and make sure you send these in a lab pack to the lab, and we will get those results out to you. If you have any questions or comments, feel free to reach out to lab@serviamdiagnostics.com. Thanks.